We're talking about a consultant radiologist, we're talking about a regional head of processing, and I want to make sure that everyone gets the title and the desire, the introduction they deserve from franchise director on down. We're going to have a great conversations. Take it away. Everyone has a microphone. It's working. Just do a little test. We got to make sure you can be heard. Great. And if there's something you'd love to hear from them, take a picture, hashtag their name, make your comments live with hashtag Health2Conf. See you guys soon. Time is on the stand right here. And if you want questions, just finish a few minutes early, okay? Have a great conversation.
Thank you. I'm Dr. Rashmi Sanjay here. I work for Manipal Hospital in Bangalore, India. I take care of the processes and operations of the 12 hospital in the South region. I'm glad to be among you here. Thank you for being.
Thank you so much. My name is Ahmed. I'm a senior director of therapy area in a pharmaceutical company called NewBridge Pharmaceuticals, responsible for the Middle East and North Africa. I'm responsible for the gastro and metabolic franchise in NewBridge Pharmaceuticals, and as its name implies, it's bridging companies and innovators from across the globe to access the treatments and innovations to the Middle East and North Africa. Pleasure to be here with the panelists.
Good afternoon. Good afternoon, everybody. Greetings of peace. And myself, Dr. Roja. I am from Global Hospital and Research Center, which is doing a lot of service for the rural and tribal region in Rajasthan. And we provide advanced healthcare to everyone, including those who are not able to afford. And our aim is to bridge the gap and provide the best healthcare facilities to everyone without any social or economical gaps or no disturbances in this aspect. I'm happy to be here and be part of this panel and looking forward to great discussion. So today I will be moderating. I will be asking Mr. Ahmed, like, how do you see private healthcare system as a backbone? And because you are in pharmaceuticals, what do you think you are looking at for the future? Everybody in the audience and everybody believes that, government alone cannot do everything in the healthcare system. Private also have to be part of it, and because there is a huge gap. But from your side, what do you think needs to be done, and how do you see it?
That's a very long question, but I'll try to address it most. But putting it into the frame of the discussion today, talking about the developing countries. So actually the private healthcare system in developing countries varies a lot compared to developed ones. This sector emerged in the developing countries just to fill a gap, especially that these are developing countries where the GDP healthcare expenditure is not enough to cover the healthcare needs. So talking about developing countries, there was a gap between the public healthcare service and the needs by the patients in the populations, especially for developing countries, where the private sectors emerged here to fill that gap, to fill a gap of long queues of waiting for the services to get, for confidentiality of the data of the patients which might be missing in a developing country public sector, to fill a gap also in the quality of the service, speed of the service, and also the innovations that might not be brought up to the public sector. So this gap, yes, the private healthcare sector filled. Efficiently or not efficiently, this is debatable, but the private, and other part here is being profitable sector to provide the service with profit. So it was an appealing gap to fill for the private healthcare systems, but was it properly filled or not? It's a long story that I hope we can dive through.
Dr. Rashmi, I want you to add what do you see as you have been in this field for more than 18 years, and how do you see the private healthcare system is growing and helping and becoming more stronger day by day?
See, as we are seeing at present, the increasing demand of the population with regard to healthcare, because of the longevity of the population, graying of the population, there's a lot of demands which has been raised on to the comprehensive treatment to be given to the people which cannot be dealt alone with the public health sectors because of the resources which has been very limited, capacity is constrained, and in developing countries there is no more such of government aided, because they're not able to get that much of medical advancement because of the scarcity of the resources like capital investment. So private healthcare institutions is a must, or is it trying to fill the gap in providing that type of healthcare services which can, along with the public healthcare system, be provided to the population, because as he has already established that, he's already told that there is a long of waiting time, and because of the treatment we cannot expect a person or a patient to travel from a developing country to a developed country because of the cost involved, and it enhances both of the cost for the patient. So if the private and the public work together and fill the gap, the treatment can be done in the hospital or in the same country. So I think so the capacity to increase the base of the pyramid of the healthcare facilities, a private hospital is a must. At least it's doing its best. Yeah, it has its own challenges, as Ahmed had told, that it is not, has its own challenges, but we are trying to grapple the needs of the population.
One more thing, I feel like private setup are more open, are more experimental, and they are innovative also. They get collaborated with different needs. They are open and they are aware of the needs of the society. And then the others also do approach them very easily. They collaborate, and then with the cooperation we are going easily moving forward. Whereas in other sector, in private, if you see government sectors and all, maybe it's a slow process, whereas in private sectors, you think this happens very easily, and we see a win-win situation for everybody across the healthcare system to be part of one and taking it forward. What do you think, Mr. Ahmed? Yeah.
So actually the private, anyways, the private sector in any industry is more agile, and they are more responsive because their pockets might be even deeper than the country, than the public itself. So this agility is based on the, yes, where can we see the win-win situation? One of the win-win situations is expanding and leveraging the coverage, which is one of the important, actually, this is the most important mission of the private healthcare sector, is to leave no one behind, not covered or not accessing their treatments. So they do have the agility to expand, and that's what we see actually across the region here, where more private institutions are opening more branches, opening more sites, and we see here actually some chains of hospitals for the private that are widespread across the Gulf countries, in UAE, in Saudi Arabia, in Bahrain, in Kuwait, and Qatar. So this privatization is achieving the most important mission, is to access more patients and to provide services for more. And this agility is coming from the investment capability. If they do have the investment capability, they can expand that, they can often serve more patients to reach their treatments and fill more gaps. But the case is quite different in the developing countries, where this gap and this investment pocket is not usually available. And sometimes the regulations and the legislations in the country govern this. And this needs to be actually governed. Yes, some developing countries reach to the level of, let's say, perfectionism in the privatization, but the others are really suffering. And this is the challenge in the developing countries, that the private healthcare sector might not be efficient enough, where there is a waste of resources sometimes, or sufficient enough to reach the rural areas, or equitable enough to provide the standard of care. And here comes the role of how the government can provide support to the private to excel, both together. This is the mission that needs to be tackled.
Dr. Rashmi, what do you think how the government supports the private healthcare system over the years to reach to the masses? Because private has a limitations, but without the support, I think we cannot move forward. In your experience, how it helps and how we can collaborate more and then take it to the grassroots level?
See, the government has a big role to play for the private establishments of the healthcare to enhance its services and reach to the masses. For example, the government has to help the private industries with the help of health infrastructures, legislative and medical advancement which has been able to get from imported. So all that they have regulations, there's a little tedious regulations and rules and regulations they are put forward. So that regulation, if they are able to streamline a little bit so that the red tapeism type of, it doesn't cause that stock because of the government. Many times the paper doesn't move from one desk to another. And during that case, we may not be able to give or enhance the services of the private care because it gets stuck at every level. So if the government makes a little more easier way and there is a very streamlined process, the healthcare can actually be benefiting to the masses with the help of the government. So the government and the healthcare of the private has to work in tandem so that the country is benefited, because the healthcare index of any country is dependent upon its infrastructure, healthcare facilities, competencies of the doctors and nurses, and the government readiness. So the government readiness is nothing but the private and the public healthcare sectors work together so that we may be able to tackle the unknown or the diseases which we have already seen during the COVID. In the COVID, we all stood together. In the government also helped the private, and we were able to treat the people. And that time, it's when all the aircraft was been, or airplanes or logistics has been not been there, but still all developing countries treated their patients in their own countries. So I think that is the time when everyone stand together. So I think in future also we are able to stand together. The health index of the government or the country will be able to go up.
Yes, I see you are very rightly said that in COVID times everybody cooperated with each other and then we could handle the situation. And also there is an expectation from the private healthcare sector that they are on par with the changing times, and we don't know in future if anything such situation similar like COVID happens suddenly. Are we all ready, and how are we kind of preparing ourselves, and what are we planning for the future? That I think every person has to think right now. So it will be, once we are prepared, nothing will happen. Usually that is the way, and if you are not prepared, anything can happen. So how do you think the private healthcare system should be prepared for the future changing environment, changing disease patterns? There are so many things changing around us.
COVID was definitely a learning for the private healthcare sector. The most important and the most pressuring learning for the private was on the cash crush that happened due to the stretch of the cost of, like for example, the personal protective equipment from COVID and respiratory measures taken to avoid more contact, like remote consultation, telemedicine, lockdowns that prevented patients from going to their healthcare providers in the private sector. So whoever survived COVID should be ready for the next. But what are the learnings from COVID that needs to be taken forward? This cash crush requires the financial support. And this doesn't mean that the governments needs to pay. They cannot pay, otherwise they should have spent on the public healthcare sector. When we are talking about public sector, and public sector in developing countries, so it's challenging to ask them to to pay for the private. But maybe they can do it in a way or another, like supporting loans or grants or funds, or even calling for international pockets like the World Health Organization or the International Bank to come and support, because this kind of support couldn't be sourced by the government itself. But again, it impacts again positively. If it's sourced correctly, it will impact the GDP in an indirect way, like more patient longevity, like surviving chronic diseases, better productivity to the government, and then enhancing the quality of life. I think that avoiding this to happen again needs starting a dialogue from now between the private and the government and addressing the capabilities in the public that could help the private and the other way around.
Yeah, to this I would like to add that from my experience in our own hospital, like there was so much of cooperation and collaboration happened during the difficult times. It was not only because we being a charity hospital, charity organization, normally we do get support from the NGOs and from local groups and many organizations. But during COVID time, we had also seen the local people, kind of coming forward and helping, cooperating, taking responsibility. So mainly I think if everybody feels, the moment we feel responsible and we are here to provide the responsibility, the moment we take it, then the support systems already starts moving us towards us, and with the cooperation, and everybody can deal with it. So private organizations have to feel that responsibility. Yes, we are here not only to be a profitable organization, but also as a part of responsibility for the humanity, on par, along joining hands with the government. This is what I think. You can add more on this.
I can add also more from my seat as a pharmaceutical company, which is a private company that's not looking just for profit, but for patient quality of life. And we have adopted this in whatever products that we can provide in the COVID period. And I think many companies, it's not just NewBridge, but many companies have provided enough free of charge support to reach the patients who are really marginalized or poor patients through the governments, actually, to provide them with continuous supply of treatment, regardless the private healthcare sector, let's say, suffering or not being easily accessible or not. And a lot of companies actually played an important role in the vaccination of the population by providing free of charge vaccine shots and bulks and batches to poor countries, which is our corporate social responsibility to do.
So, Dr. Rashmi, what do you think, how you were able to get the cooperation during the difficult times, being in a private setup?
That was one time when we saw the pharmaceutical company and the government all standing together with us. For example, there was a lot of bed shortage, and the doctors, resources, nurses, everyone was shortage. That time the government stood, and then they started allotting the beds. It's not that a private institution alone we couldn't allot the beds, because ultimately it is the government, and we also are a part of the citizen over there. So the government took the forefront and started allotting the beds, and the bed was being given to the more needy person, and the doctors over there gave us a protocols telling what type of patient needs a bed, need not need the bed. And well said, for the vaccination, it was the no time when we have seen that vaccination can come to the masses so fast, because it takes a lot of trials, lot of R&D goes to get a vaccination to come to the public. So this was the time when we saw the pharmaceutical company fueling them, propelling it to giving to the vaccination. And this was the one breakthrough with the pharmaceutical gave for us, that the vaccination was being given to the public at the earliest, which was never done in the previous years, to say. Because the COVID more or less also had the same, around 100 years back, we had something called as Spain flu or something. That time majority of the population didn't get vaccination, and for 2 years or something there was a continuous death. But the pharmaceutical company and the government support, where they stood together and they get the vaccination. So that was one time which I've never seen in history, that all three verticals stood together, and so that the people are
together,
and people are being treated.
Yes, and I think it is finally we have to say that it is not only the private healthcare system which is a backbone. It is both together only. It will be workable for the future. It is never in isolation, and be it pharma, be it other technology developing aspects, innovations from the new creative medical technologies emerging, and also the private health setup in providing a quality and advanced healthcare. So because private health sector is very easily can dive into it and take it forward into the new systems, adopt and then see and experiment and take it forward. And the government needs to support, be helping, and with this and everybody involved together, they can make a healthy society, because if there is health, there is happiness, and everybody will be happy.
Yeah, agree, because
and ultimately
we also are in the same. Private institutions are nothing but a small part of the ecosystem.
Yes.
So private and the public work together, only it happens. Happiness, what you do.
Yeah, we can make it a better society, a healthy society. Thank you so much for joining, and thank you for the audience. And if you have any questions, you can ask.
It's time. Come on up, give them a round of applause. Thank you guys for a great discussion. Really nice, love it. I feel like there's angels up on the stage, right? So who's coming up to the microphone? Who's coming up? Who wants to engage? Ask some good questions. I see a hand back there. Does that mean you don't want to come up? I got to come to you? All right, I'm coming. I'm walking. Here we go. How are you doing? Please introduce your name.
Hi, I'm Prabha. I'm from a medical communications company. So when I see this backbone of healthcare, private healthcare systems, we have worked with some of the pharmaceutical companies and other private healthcare systems in developing patient education programs or disease awareness programs. So now my question is, what is the importance of this patient education, drug awareness or disease awareness programs, and what should be the role of private healthcare systems in developing these programs? So this is one of the factors that has been in developing the healthcare systems in these countries.
So I may take a half and he may also add on to it. See, to be a medical profession, we study from 5 to 6 years, and we expect our patients or the customers to understand the disease pattern or disease in a matter of 5 minutes or 10 minutes. It is not so. So the medical, if you have awareness treatment program is very much important, as much we do the treatment to the patient, because we can't expect the patient to know the pros, cons of what is a disease, because we also study for a pretty long period of time to understand or diagnose a disease pattern of a patient. So awareness program is a must, because a patient should know the preventive, the therapeutic and the post-treatment as well, because the disease pattern doesn't stop when you're having a disease or something. You can have a preventive, then during a disease stage you can be therapeutic, and after that you have a post-treatment. So for this, awareness program is a must, because ultimately as a patient, the ball is in the court of a patient. The patient has to understand what has gone wrong with him to come back to us, because we may sit in a hospital or the pharmaceutical can develop the medicine and the government can give the facility. But if the patient can't use it or don't know how to use it, then everything becomes a waste.
But I think one more thing is we can add patient education digital platform we can create to increase the awareness and educate them when to reach out to the hospital, when they can be
Yes.
at least at home with support at home.
Adding to this also, our mission as healthcare providers, either a company or healthcare service providers, is to shorten the journey of the patient and to avoid more suffering. So lessening this journey starts from the awareness of the disease, the symptoms, and then how to early diagnose and when to go to the doctor and consult for which symptoms that might be alarming, And then further on how to use the medication properly to avoid lack of compliance or adherence, which eventually will cost more. Cost the patient, cost illness, and cost the government and the private sector as well. So that's why we are doing the awareness to get the patient treated as early as possible.
So the technology which is been there, medical technology, binds the healthcare and the patient together because it is a mode of communication. So awareness program is a must, and it can go in any part of it, in any digital platform or verbal anytime. But only thing is that patient should understand, or the customer or the population, because disease doesn't knock anyone's house or doors. It comes without stating it's coming.
Thank you. Did she get the answer that you need? Fantastic. Okay. Anybody else? Anyone else have a question? Oh, she's going up to the mic.
Hello?
Hi.
Yeah. Hi, I'm Swetha from Dr. Reddy's. Even in my company, I think a lot of such campaigns goes on in different rural areas. Because as you see, you're talking about the digital way of, awareness. But whereas you go to the villages and all, it's difficult for them to receive as part of, digital awareness program. We have to go personally and give the awareness to the patient with respect to, very communicable diseases like diabetes or cancer or any other pregnancy-related issues. I think that way, I think they can receive very easy way. Awareness, I think it will increase that way. Digital platform, I think maybe the people who are, capable of taking a receptive in the digital way, that's good. But in the villages and all, I think personally we have to go and educate them.
Yeah, you are very right in this aspect, because we deal with a lot of rural and tribal areas, and sometimes we really have to tell them, please take medicine also. We have to educate them. So we kind of really engage, first of all, we train somebody in between and then send them for door-to-day checkup, and then for awareness, whether they are having any problems with the eyes or any particular disease like TB or anything, and whether they are taking proper treatment. And so it is not very easy, but yes, it is possible. That is what we are doing, trying to educate them and then trying to provide treatment at the earliest possible stage so that they don't suffer much. That is one way of looking at it, but it takes time, a lot of time, and many people have to be involved in this. Yes, I do agree this, everybody cannot be reached through digital platform. Yes.
Thank you for that. I know someone else had their hand up. Would you mind just coming up to the mic? Time is something we wish we could buy more of, right? There's no doubt, especially here at Health 2.0 with all this great content. But please, we have a few seconds left to hear your question. We'd love to understand and answer them, right?
Thank you very much. Great panelists. It's great discussion. I just would like to follow up regarding education. What tools do you use to educate the community? Do people have cell phones? Can we gather them in one place? It's so difficult. Do they watch television? Do you reach out to workplace? When we come actually and look in a person's eyes, like I always tell, I'm an oncologist, when I look in the patient eyes, what can I offer? So realistically, without fancy technology, how do you reach out to the population? Thank you.
See, in developing countries, we reach out in various methodology. First, in the rural areas, we do camps so that the patient awareness happens. And once camps happens, then we do treat. There is not only the patient, but we do also have to connect with the local family physicians. So we do webinars with them, and we do have a doctor-to-doctor connect. And then we have a community type of connect where we do camps that I had already told. And then nowadays, because of the technology, everyone has a phone, Android or iOS. They do Google. As far as in developing countries, what I've seen is that patients do come with a Google doctor, and they come and tell this doctor telling so-and-so disease is there before we diagnose or my doctor's diagnosis it. So underestimating our customer and they don't understand things, it is no. People do know what is happening around because of technology, everything has been connected. This is what I need to say.
Great, I know you have an answer, Ahmed. Go for it. I'll let you close up your panel with an answer, right?
I'll consider the time as much as possible. So I cannot exclude digitalization and technology from reaching. It's the most cost-efficient way. But the best way is to have also a word of mouth or of awareness, like having a World X Disease Awareness Day that is being started from activities in the hospitals, universities, and even schools to raise the awareness through the right channels.
Fantastic. What a way to end. We're talking about word-of-mouth marketing. Thank you so much. I'm sorry we don't have any more time for questions for this panel, but what a great time to hear about this private, how healthcare is really being driven from these governments. Before you go, girl, before you go, we got to remember this moment together forever. We're going to post it on social. You can share it and let people know. I know you've had a question there. While we have time, all those pictures, just throw out the question. At least they can hear it, and you guys can talk about it later during a coffee break, right? If you want to take any of these conversations, outside's the way to do. Please share your question on the mic if it's a few seconds short.
Yeah, I work on a rare disease, and then you just described an example in infectious disease. I just wondering what it's like in rare disease area, so I might catch up later.
Fantastic, thank you. So you see she has a question, she wants to engage, it's a conversation later. So when you get a chance, you saw her come up to the mic, look for her later and you guys can talk a little bit more. Thank you, panelists. It's incredible day at Health 2.0, day 2, second half of our day. We're moving along.